And we're back with the Beaufort News. Dr. Audrey Klenke is with us. She is a plastic surgeon, but she's also the principal of the Pinnacle Medical Group. Audrey, or Dr. Klenke, it's so great to have you with us this morning. Thank you so much. We have a lot to talk about because you all have been very, very busy in kind of re-engineering your medical offices to actually be emergency relief centers. So let's kind of get back to the basics. What have you all been doing, and what kind of visits are you seeing at your sites?
Right. So as everyone knows, our country and the world is undergoing some pretty intense changes, and we have to roll with the punches, sort of. You have to use the whole, when life hands you lemons, make some lemonade. And so this is the medical version of that. In my practice, we've used telehealth in the past, but it was mostly for patients who were out of town and maybe were traveling for surgery. Hilton has a nice destination. People like to come here. But now we're actually using it for patients in a much broader sense. So people who perhaps are already our patients and maybe have questions, or who have a new rash or a new skin lesion or something that they want us to see, but maybe isn't an emergency. They don't need to come into the office. We're also using it for new patients. We have some patients who are curious about what we do, or maybe want to talk about cosmetic things, and they're sitting at home and have some extra time on their hands. And so this would be a perfect time for them to sort of get to know us as a practice and ask questions and sort of feel us out a little bit. So the telehealth thing has really taken off, and thank goodness for technology. All you need is a computer or a phone that has a camera and a microphone, and off you go. It's really easy.
And so this is also a way in which you can relieve some of those visits and some of the patients going to the local ERs, right, Dr. Klenke?
Yeah, so we are starting a campaign called Gotta Cut, Get It Shut. And the idea was, again, born out of necessity. So we know that right now, our state and our county, we're not overwhelmed in the sense that New Orleans or New York or California, but we know that the cases continue to rise. So likely we're going to have a lot more cases, and our hospitals very easily can get overwhelmed with supplies running out. Staff are getting burnt out. So for things that I would normally see a patient in the emergency room, like a laceration or a small cut or a burn wound, something relatively minor but that often needs a plastic surgery expertise, those are things that now we're trying to see in the office. So I've worked with the local ERs and even just putting it out there on our social media that if a patient sustains some sort of minor injury, the first thing they should do is really call our office and say, hey, this happened. Let us sort of investigate and make sure that you're appropriate for our office. And we'd much rather keep you out of an ER, try to prevent you from increased exposure if we can, and try to preserve those precious supplies and the morale of our personnel in the emergency room.
So, Dr. Klenke, this transition in your office sites, has it been challenging, been difficult? What steps have you gone through to make this happen?
It's been kind of crazy, but really, honestly, we have an amazing group of people as our team and our staff, and they have been more than willing to accommodate the changes, and people have been just so willing to help, and that's sort of how we see it. This is really our answer to how do you help your community, and we all need to be doing something to help, whether it's doing simple things like staying home or trying to do things like this where we try to protect each other. And I've sort of joked as a plastic surgeon, it's a little bit of fish out of water. If you put me in an ICU setting and told me to run a critically ill patient on a ventilator, I haven't done that for years. So you have to ask yourself, what can I do? What can we do? And this is sort of what I do and what we do every day. So why not try to help in this way?
Now, how can your offices qualify to be able to do this emergency relief? So has that been a difficult procedure?
Well, not really. I mean, there are things that we can easily do these things in the office. It was really a time issue, and sometimes it can be a supply issue. So we really had to sort of ramp up our own supplies as much as we can, and yet try not to be what they call hoarding. We don't need, thank goodness, lots of toilet paper for this. I still don't know what that craze is, but we don't want to take supplies away from the hospital. So we have to have the essentials for what we need. It's mostly suture. And luckily, that's not something that you need right now to fight COVID. So we're not hoarding masks and gloves and cleaning supplies. We've got enough of what we need, but we're not taking extra on.
Okay, so Dr. Klenke, in our final 45 seconds, again, who is eligible for a telehealth visit, and then how do you make that appointment again?
Sure. So anyone really can call. And the easiest way is just to call our office like you would for a normal appointment. So it's area code 843-815-6699, or you can find us online at pinnaclemd.com. And when you call, our staff have been educated on how to triage people. So we usually communicate first before you actually come to the office and make sure that it's appropriate. And then we sort of work out times so that we're limiting the number of patients that are in the office at one time.
Oh, great. Any final kind of thoughts or advice for patients, new patients, older patients, this telehealth concept?
Really, we just want everyone to try to stay safe. I mean, if you can, please try to stay home or try to stay away from others as much as you can. Really, we've got to do as much as we can to try to slow this thing.
Right. Thank you so much, Dr. Audrey Klenke with the Pinnacle Medical Group. Appreciate it.
Thank you so much.
And we'll be right back with Officer Hatchet.